Rwanda has received a consignment of 247,000 doses of AstraZeneca through the COVAX initiative. This Friday, the vaccines have been deployed to hospitals across the country ahead of the nationwide vaccination program set to begin on Saturday, 29th May 2021. Some of the recipients of the first dose say despite the delay on receiving the second dose, they are happy that the time to receive the second dose is here and that they hope that receiving the second dose will strengthen the immune system. We are happy that we received the first dose, and now we are even happier that the second dose is here.
They told us we would receive our second dose after 4 weeks, but it went beyond that. We are happy that after taking this second dose, it will strengthen our immune system.
As part of the distribution process, the Rwandan Air Force deployed the vaccines to remote areas in the country, delivering them to district hospitals. Some hospital and district officials say they are ready to administer the second dose to those that received their first AstraZeneca dose.
We have received the same number of doses like the last time, and we administered them all. The health workers here at the hospital are ready to start administering the doses. We've received 10,000 vaccines. This is the same number we received the last time as well. They are currently at the hospitals and will be distributed to district clinics in due time. The vaccination program will begin tomorrow and on Sunday. In these 2 days, we hope to vaccinate all those that received the first AstraZeneca dose, and that this will help boost the immune system that will help fight this pandemic.
Rwanda rolled out the first vaccination program on March 5, 2021, administering the first dose of Pfizer and AstraZeneca. The first dose of AstraZeneca was administered to 290,000 people. The second dose of 247,000 vaccines were given to Rwanda, including 117,000 that were donated by the government of France. Gabi Muvunyi for RTV.
Thank you very much, Gabi Muvunyi, for that report. And still on this vaccination program, this evening we're joined by Rwanda Biomedical Center Director General, Dr. Sabin Sanzimana. Sir, thank you very much for joining us tonight.
It's a pleasure. Thank you.
So regarding this vaccination program, how many people are set to receive the second doses of AstraZeneca?
Yeah, we're planning to give the second dose to everyone who received the first dose, which means that they received it at different times. We started on March 5th and takes over some days. Majority received it the first week. But now, as we start tomorrow at 7 in the morning, those who have already attained 8 weeks after the first dose are invited to any health facility for taking their second dose. We expect that by early next week, I will be able to cover most of the people who received the first dose, and thereafter I will be waiting for others, just a couple of others who, for some reasons, came in a bit late and are not yet at the 8 weeks, which is the minimum time for someone to get the second dose. So it's basically from 8 weeks to 12 weeks. So in general, most of the people who received the first dose of AstraZeneca have reached almost 9 to 10 weeks, so exactly in the middle. So we see by Tuesday next week, we're probably going to have reached a majority, almost everyone for a second dose on AstraZeneca.
All right.
Yeah.
And so, except vaccinating people who have already received their first dose of AstraZeneca, how is the vaccination program all over the country standing as of today?
Yeah, I think today we've deployed the vaccines from the central warehouse here in Kigali to all districts. Then the same this afternoon, all health centers pick their vaccines from district hospitals. So now, as we speak, all health centers have already their vaccines at the health center, and the people who are coming for second dose tomorrow morning will be getting their second dose at their health facilities. It doesn't mean that if you have traveled from the place you received the first dose, you have to go back to the exact same health facility. If, for example, you received the first dose in Rubavu, and today you are in Kigali, you don't need to go back in Rubavu to take your second dose, because our system is centralized. So wherever you go in a health facility, health center, or hospital, your data, your names and ID or code that actually been sent by SMS will be entered in the system. So you'll be able to get your second dose without moving around to find your initial facility. So this helps to get people accessing their vaccines without having to move around, but also it helps to give the vaccines faster because all the 500 facilities will be offering the vaccine at the same time. So we don't expect crowds of people coming to one facility or a few. If you come in one health center and it's too many people, you can move to the next one. All those options are accepted, just in the framework of giving the vaccine as fast as possible and as convenient as possible.
And so, still on this program of the vaccination, in general, how can we say the program stands as the country intends to vaccinate at least 60% of the population by 2022? How is the vaccination program generally standing in the country?
We still have a long way to go. We've already covered 5% of the people who have to vaccinate. So if you think about the number of people on waiting to get vaccines, but it's not going to happen in one day. It's a plan that is taking us up to next year. The faster we get more doses of vaccines, the better we can attain 66% or 60% of the people that we've set as a threshold to say if we vaccinate 60%, we'll be able to cut the ways of transmission from one person to the other. But as of now, at 5% of people only covered, you can't say that the current measures of wearing masks or social distance, even hand washing, are going to be changed because we still have a very few number of people vaccinated.
All right.
Some countries that are expanding their programs to reach that number. So we're also doing the same. Unfortunately, vaccines, the doses are not available as we wish, but our government is doing all the possible options to get vaccines as soon as possible so that we can go back to our normal life, which is possible if we continue to keep the current discipline and measures ourselves, individual protections until we get to that level. So there's a hope, but we have to stick on what we have achieved, protect our gains. So when we reach 60% or more, we can be able to enjoy some other ways we had before COVID-19.
All right, so back to these people, the program of vaccinating people who had already received their first dose. Some were worried that it's been way long since they received their first dose of AstraZeneca, and now that they're going to receive the second one, it might not be as efficient as it could be compared to the way they could have received it a bit earlier. What do you have to say about that?
That is not true. Actually, this timing we're giving this second dose, it's far better than having anticipated giving a second dose after 1 month or after a few weeks. Because the facts, the evidence we have is that during the previous trials of AstraZeneca vaccine, it was shown that after 28 days, the protection that it provides can be around 77%. But later on, continuous studies have shown that if you can wait up to 12 weeks, between 8 and 12 weeks, the protection or the efficacy of the vaccine is increasing from 77% to 85%. So that's why we, even in our guidelines, in World Health Organization as well, the minimum we can take the second dose for AstraZeneca was set at 8 weeks. And now we're talking about giving the second dose after 9, 10 weeks for majority of people vaccinated. So it's at the right timing, between 8 and 12. We expect the people who are going to get the second dose to increase their response to that level, which is actually the optimal. So it's good. It's a good timing.
All right. So, and finally, yes, the number of COVID-19 infections in the country have reduced with time, and I can say the country is progressing in terms of fighting COVID-19. But generally, how can we say Rwanda stands, and where does the country stand today in terms of fighting the pandemic, and what are your recommendations to all the citizens of the country?
Yeah, the COVID keeps changing for sure, but the current status or the trend of this pandemic in Rwanda is, I would say, an interesting levels if you look at where we came from. Generally, we have 3 levels of assessing the trend of this pandemic. There's a low, moderate, and high levels. So we've spent almost 1 month in low level of transmission with an incidence that is not going up to 1%. Actually, in Kigali is 0.5%. There's a time Kigali was up to 8%, even 10%. Early January, December last year, beginning of this year. So today we see a good trend. If we can keep it until we vaccinate more people, that will be a perfect way of containing and controlling this pandemic. But there are some districts that we're seeing now have seen increase and the set of cases, such as Karongi district, in the past 3 weeks. We see Gicumbi as well. So those 2 districts are getting better as well. So we have new data that they have improved, even the measures that the government took recently. But the thing with COVID, you can't say that this is a situation that will be tomorrow. So it keeps changing, and the changes happens with our behaviors. If I don't take and use my mask and I move around, and we are many like me who are doing the same, then the result will not wait. You will see the impact, negative or positive, out there. You remember in December, for example, the Christmas parties, the weddings in November, the behaviors that we as people were having just translated into the increase in death that we've seen in the beginning this year. So as we enter into the summer time, we need to be very careful, especially this is the time when people organize more parties, weddings, different ways of enjoying their lives. In one way, it's good for human beings, but in another way, you need to think very carefully if the party you're talking about or the wedding you're organizing and bringing people together, then your guests will become patients and get COVID next days. It's not something we would really want to happen again to us. So it's a message that I will pass on to say June, July is generally a time where people tend to do those kind of events. So we have to be careful so that our gains are not lost in just this summertime.
Thank you very much for your time, sir.
Thank you too.